I'm Dr. Bharath K. Kadadi, hand and upper limb surgeon practicing in Bangalore for the last 25 years. Well, in Manipal Hospital, Malaysia, we have been doing these surgeries for 1.5 decades now. The brachial plexus birth injuries were children born with the paralyzed limb who do not recover spontaneously beyond 6 months. We explore and operate them. We have a good team who can and the technology to take care of these children, and we follow them with physiotherapy for 1 to 2 years so that they get back full outcome. Another department of treatment of hands is the wrist. The later developments is the wrist arthroscopy, where we do a minimally invasive surgery to treat the ligaments of the wrist, ligament repairs, TFCC repairs, or scapholunate repairs, and also the scaphoid surgeries. So all the wrist surgeries, we do minimally invasive keyhole, that is arthroscopic surgeries, so that the outcome is much better and they can get back to their normal activity earlier. Other aspects is industrial accidents, road traffic accidents with they sustain the hand injuries and they're not able to use them for day-to-day activity. Imagine a single finger which is stiff. It's so difficult to hold a brush and use it for your day-to-day activity. Your whole activities of daily living gets affected. So our aim is to treat these problems, even if a fresh injury, repair all the structures which are injured and get them back to normalcy. Or a delayed problem who come back 6 months, 7 months, 8 months, 1 year down the line. You can also treat them by correcting the deformities, correcting them, and then getting them back to normalcy. In addition to that, we also have the patients getting aged patients coming with rheumatoid arthritis or osteoarthritis, where they have arthritis of the small joints of the hand, where we can do the replacement of the small joints of the hand and getting back to normalcy. The whole idea of treatment is you should get back to their previous level of activity, a previous level of occupation, so that they should get back to, the purpose of a hand clinic is to observe them, assess them, diagnose them, investigate, treat them so that they get back to their normal previous level of activity. Because hand is function, no hand, no function. So the most important and the productive and the economically productive unit of the body is the hand. The most functionally productive unit of the body is the hand. So hand, no function, hand, no function. Well, we hope and I'm sure this information is useful regarding treatment of the hand problem and then the purpose of the hand clinic. So please share among your loved ones and share your comments.